Dr. Andy Evans, Associate Professor of Medicine at University of Massachusetts. Our study was a prospective phase 2 study in newly diagnosed Burkitt's lymphoma. We took a standard regimen known as the McGrath regimen, which is Codox-M/IVAC chemotherapy, and we had two hypotheses. One, we wanted to add high-dose Rituximab. It's known that the Burkitt lymphoma cell has a very high density of CD20. So that was the first hypothesis, integrate high-dose Rituxan. And we gave it at 500 milligrams per meter squared on days 0 and 8 of the Codox-M cycles and days 0 and 6 of the IVAC cycles. The second intervention was to integrate Doxil chemotherapy in lieu of Adriamycin therapy. So it's a rare disease, Burkitt's lymphoma, and it was only 25 patients, but it was prospective, multi-center. We allowed HIV positive and negative, and the outcomes, I'll just kind of point right to that over here. For all patients, the progression-free survival and overall survival was 86% and 86% respectively, and moreover, to the right, in the group of HIV-negative high-risk patients, disease-specific survival was 100%. The only relapse was a 69-year-old man at about 15 months from unknown causes. He was in remission. And so, again, it was a small study, but I think at least what we concluded from this was that at least in HIV-negative patients, it was safe and effective to add high-dose Rituximab therapy. One comment is we only had 4 HIV-positive patients. 2 of those actually relapsed. So I'm not sure, it certainly is preliminary and we cannot conclude. I would probably not use this regimen for them. I would more specifically for HIV-negative patients.